Hey everybody, my name is Eliot Cohen. I'm the Dean of Johns Hopkins School of Advanced International Studies, and I'm really pleased to introduce today's Dean's Forum. It's going to be a discussion moderated by my colleague, Andy Mertha. The topic is how the public health crisis undercuts Beijing's global ambitions. And our guest is a real expert on the subject, Dr. Yanzhong Huang, who is a senior fellow for global health at the Council on Foreign Relations. He's also a professor and the director of global health studies at Seton University's School of Diplomacy and International Relations. He's a very widely published author, including most recently, Toxic Politics, China's Environmental Health Crisis and its Challenge to the Chinese State. He's extraordinarily widely published in both the scholarly world and in newspapers and journals like Foreign Affairs. He's frequently testified before congressional committees. And I think from a SAIS point of view, the thing that's most important is that from 1992 to 1993, he studied at our very own Hopkins-Nanjing Center. The discussion is going to be led by my colleague, Professor Andrew Mertha. Professor Mertha is the Vice Dean for Faculty Affairs and International Research Cooperation. He's also the George and Sadie Hyman Professor of China Studies and Director of the China Studies Program at Johns Hopkins University. He taught previously at Cornell and at Washington University, St. Louis. Dean Mertha specializes in Chinese bureaucratic politics. He's also published extremely widely on that subject and on others, including as well on Cambodian politics. Is someone with remarkable linguistic gifts, being fluent in Chinese, Khmer, and Hungarian. With that, I think I'm going to turn the floor over to him, and I look forward to joining you all for what should be a fascinating conversation. So, Dean Mertha, over to you.
Thank you very much, Dean Cohen. I'm just, because we only have an hour, and I think every minute counts because of our terrific speaker today, Yanzhong, or Professor Huang, I'm going to give the floor over to you.
Well, thank you, Andy. Well, it's a pleasure to see you again, and congratulations. And being, I think SAIS is very proud to have you as a leading scholar in the field. It's succeeding Mike to be the new China person at the Johns Hopkins SAIS. And thank you, Dean Cohen, for the introduction. I'm indeed very proud to be alumni of Hopkins-Nanjing Center. I remember I was, I think when I was a high school student, I read at that time from People's Daily, that might be 1986, talking about the launch of the this Johns Hopkins Center. And I read it and said, wow, what a fabulous program. I wish I hope one day I could join that program as a student. And I didn't. When I was I thought it was just a wishful thinking, but I didn't expect that 6 years later, I actually became a student at the Hopkins-Nanjing Center. And as I told Dean Cohen, the center basically changed my life trajectory, where I noted my interest to study in the United States. And in the meantime, my friendship, with the faculty members and the students there, this began this, this decades of friendship. So I really appreciate, I'm thankful for the Johns Hopkins SAIS, for that opportunity. And I'm delighted to be here.
So, Professor Huang, why don't we just get right into the thick of things? So, the title of this program, I think, sets the question perfectly, which is to say, much like your book, Toxic Politics, which for those of us who are listening and tuning in, wait until this program is over and then go out or go onto Amazon and buy this book. Because what's really, really innovative about it, or one of the many things that's innovative about it, is the way in which Professor Huang is able to marry two key topics in the study of politics, and in this case, the study of Chinese politics, that is to say, the environment and public health. And that's something that I had not seen before. And so being able to kind of marry key political questions and issues in a seamless way, but which raise kind of important questions, is something that you do very, very well. The title here, how public health crisis undercuts Beijing's global ambitions, you're really looking at two huge things here. So first of all, the acute question is one of COVID-19. There's also the chronic question of kind of the public health infrastructure more generally. But then there's this whole other dimension, which up until January, whenever anybody talked about China, it was BRI. And then since then, it's been, so Belt and Road Initiative. Since then, it's been pretty much COVID-19 all the time. And yet the two have very, very important implications for one another. So what do you want, just to start us out in broad brushstrokes, Professor Huang, how should we look at this relationship between the public health crisis and Beijing's global ambitions?
Wow, that is a big, very, very big question. It was the title I was about to talk about. I think it was thinking developing that into a long format article, because here we talk about two types of public health crises, right? One is like the environmental health issue, that is a slow disaster, right? But when you look at the COVID-19 pandemic, that is an acute disease outbreak, right? So even though the book basically addressed the environmental health issues, the main findings, the analytical framework can also be used actually to shed light on these unfolding COVID-19 pandemic. And I could talk, for example, when we talk about BRI, right? That is Beijing's most significant 21st century, diplomatic and economic initiative, right? But it was very clear, right, that it has a connection, right, to the environmental health issues and also the COVID-19 outbreak, right? When as far as this impact on Beijing's global ambitions is concerned, well, you could make an argument, how Beijing's efforts to solve these environmental problems, in a way also leads to efforts, as some people pointed out, to outsource, right, its pollution, right, to build those potentially polluting projects in other countries, especially those countries which have this lax regulatory systems on environment, countries in Central Asia, for example, right? And then, right, you also found how the COVID-19 outbreak, right, hampers the implementation of this initiative, when we saw how, this COVID disrupted the supply chains, diverting resources, for China's own economic recovery, and leading to a loss of faith in the China-style connectivity. So this is just one of the examples how this public health problems actually could undermine one of the Beijing's most important foreign policy initiatives.
So that's let me come back from that and move to another question that I wanted to save until the end, but I can't help myself. So you, and to a much lesser extent, I were referenced in a CNN report a week or so ago. And one of the questions that I was looking at on the Twitter kind of chatter following that was the question of what was new. What did they uncover that was new? What didn't we know about this in the first place? And I think what the question really came to was that of how has the narrative changed in terms of how we understand China to have managed the COVID-19 outbreak.
Well, thank you, Andy. I think that so-called this is a secret document, right? Those 17 documents which I read. I indeed read carefully. It seems to be authentic, but we have to say, that it has not fundamentally changed the narrative on both sides. Certainly it's, and I also have to say, that there has not. Provided this smoking gun evidence that Beijing is like intentionally lying about the outbreak. But there indeed there's several developments, the information from the document that suggests something that I found very interesting. First of all, they talk about how it could take an average of 3 weeks to basically confirm a COVID case. That it's indeed amazing, especially if you consider that the incubation period for a virus was only 2 weeks. So by that time you actually confirm the case, either that person was recovering or already died, maybe. And secondly, there was this talk about a spike of flu cases in Wuhan. So in a lot of those cases, actually, that was diagnosed, indeed caused by a strain of flu virus. But there's still a large proportion of those cases could not be classified as flu cases. So there could be a possibility some of those cases, even before December, could be COVID cases. Or when you have a large number of those flu cases, people with flu, flooded into the hospital, they're seeking medical assistance. Then you have also people, the COVID patients in the same hospital, that increase the chances of cross-infection. And the third issue is that that was also to my surprise that we initially thought that after SARS, the government has invested tremendously building core surveillance and response capacities. If you see, go to any province, the CDCs, actually many of these buildings were newly built. They were. So a lot of money being spent, in building this capacity. But in the meantime, when the documents suggested that in Wuhan, the local CDC people, they complain a lot, about, lack of government investment, lack of capacities, that the morale is low, so that might also contribute to the initial mishandling of the outbreak.
So let me follow up with two questions. One is really kind of a granular micro question, and the other one is kind of builds on what you just concluded. So the first question is, in those documents, you had mentioned that so I guess it was in early December of 2019. Where there was that spike in flu cases in and around Wuhan. One of the most fascinating tidbits of information there, and it's tantalizing because it is one data point from which you can glean just about any conclusion, depending on which way which way you take it. But it remains fascinating to me empirically that the largest spike in cases at that time was not in Wuhan, but it was in Yichang. So this was, so for people who are, who don't focus on China 24/7, Yichang is where the Three Gorges Dam is located. And it is not a large city per se, certainly nothing approaching Wuhan. But nonetheless, that's where in early December, there was I think a 20 times the normal or 20 times the previous year flu cases. That's, you're talking about the reporting problems and about the morale issues and kind of the lack of funding for these reporting capabilities locally. But I remember there was also a New York Times article around that time that underscored
I think there's some audio quality issues here, Andy.
I apologize. The Ithaca IT infrastructure is not what it used to be. So the second part of my question is, given this this centralized reporting directly from, based on what I believe it was, kind of the density of outbreak of kind of flu or post-SARS types of medical configurations of flu or similar types of outbreaks directly up to Beijing. How was it that the local authorities were able to get in the way of that and undermine that reporting relationship? How do you square those two sets of circumstances?
Great questions. Well, Andy, well, sure, I know that you've read those documents too, right? It's still unknowing, that when that the outbreak, actually started. I remember that as early like mid-December, there was already on Chinese WeChat, the social media, being spreading news, there's another SARS outbreak, that was mid-December. So clearly, some of this, this is some already, this unusual, there's the developments, those cases, that may be similar to flu already or catching the attention of the Chinese healthcare workers, but we know, right, it was not until like the end of December when Dr. Zhang Jixian, right, in Wuhan actually reported, through that online reporting system, the first case, but then you have also, seeing that the local governments, local health authorities imposed very strict, requirements on how, to report such a case, So a lot of those cases that should be classified as COVID or unknowing, atypical pneumonia case, actually were not included in the reporting. They were also like Caixin, according to Caixin, right? Some of the cases, that should be reported directly to national CDC, actually were intercepted and were deleted, by the provincial government officials. I found this is very interesting because, when we talk about the mistakes, right, in handling a novel coronavirus, I think we should differentiate two types of mistakes, right? One is the mistake that it could happen in any country, right? When they were exposed, when they were encountering such a virus, including the United States, that certainly the complacency of our own CDC actually call, and so we pay dearly for that complacency here. But I think there are also mistakes, that can be avoided. Again, that could happen. Well, in the U.S., we have certainly mistakes we could have avoided. But in China, I think those mistakes are basically like bureaucratically mistakes, all those politically motivated mistakes, I think in the initial handling of the crisis could be avoided. That explains why also, right, in a way also, I think China admitted that when they sacked those, two major local government officials, right, who apparently should be responsible for those initial mishandling of the outbreak.
I'm just going to unmute myself. Thank you very much. That's really, really helpful. So, even though the system was supposed to be foolproof or tamper-proof, the provincial officials nonetheless were able to scuttle it. What I remember also was, and I thought this, I'd be curious what your reaction was, that generally speaking, the conventional wisdom or the standard practice is when local officials are berated by central authorities, they kind of submit quietly. But in this case, what struck me was the way in which various municipal officials, Wuhan municipal officials and provincial Hubei provincial officials were critical of the ways in which their reporting upwards was being misinterpreted in the evolving national narrative. Did that strike you as being significant?
Oh, absolutely. That if you actually compare to the response to the initial SARS outbreak, right, 2002, 2003, right, where you have, not just the local government officials, but also, central government officials, right, the Minister Zhang Wenkang, they played a very important role, in this initial cover-up inaction, right? That is why also Zhang Wenkang had to take responsibility, right, and being sacked, right? But in the COVID case, right, when you look at those officials being sacked, all of them actually local government officials. And my research of this, the initial government response also suggested that local government officials should play a more prominent, actually played a more prominent role in the beginning of the crises. But when you look at the root causes of the problem, it actually remain the same. When we talk about, I'm sure Andy, you know that very well. This as a leading scholar in Chinese politics. So the issue of upward accountability, right? You only accountable to your immediate superiors. You don't want to look bad, by announcing, causing a false alarm, then potentially what the fear, the panic at the local level, that is a bad sign for social political stability, right? The buzzword in China. And second, there's this issue of these two most important political events, right, in Wuhan and Hubei, right, the two sessions, right? So during that period, right, again, you don't want anything bad to happen, distracted attention. And the third issue, I think that might be something that is different from the SARS era, that is this recreation of the bandwagon polity, right, under President Xi, so when you have this rapid re-centralization of political power in a hierarchical setting, that changed this incentive structure of the local officials, right? Basically this is like sort of going along by getting along became, the main approach. So essentially you have no incentives to take initiatives, right, in handling something unusual, and you're just waiting to hear from the above, that to take the cues from government leaders before you are willing to take any bold actions.
Thanks very much. I also want to just remind the people attending this event that I'll start asking the questions that you post in the Q&A function in about 15 minutes or so, 10 to 15 minutes when we're done with the initial part of the conversation. One question that I have, and I've wanted to ask this to somebody who actually knows what they're talking about. And so, this is, finally that chance has come. One of the most fascinating parts of the kind of the unfolding of all of this, for me anyway, has to do with the timing. So that it occurred just around the time of the Chinese Lunar New Year, which in 2020 was early. It was in late January. And one of the things that people were really worried about potentially was the amount of travel that was going to take place, much like what we're seeing here in the United States. And I'll come back to a comparison in just a few minutes. But the Thanksgiving travel and now Christmas travel, and that's something that people in Europe are worried about as well. In China, the scale of that travel is unimaginable to anybody who hasn't been there and seen it firsthand.
It's like moving the entire United States.
Exactly. And yet that travel was not a super spreader event like people had thought it could be. So did China dodge a bullet there? Or is there information that has yet to be uncovered? Or what happened? Why didn't that dog bark?
Well, actually in late January, there were indeed a lot of concerns about, when we heard about this, the outbreak in Wuhan. We didn't know that whether it was a human-to-human transmitted viruses, because certainly, over the past, decades, by the Chinese people, right before the New Year's, the Chinese New Year have been moving around, right? There were, the disease outbreaks, but that didn't lead to any nationwide, the epidemic, outbreak. So, this time before actually the nature of the virus being confirmed, right? That still, I think we were not sure. At that time, I was not even sure that it was even a SARS type outbreak. I remember that we were planning to do a roundtable at the Council on Foreign Relations in January. That was mid-January. They will say, well, I was actually very concerned that the way you use that title, a SARS type outbreak, whether, where it happened, maybe where the event did happen, but that was late January. I was concerned maybe the virus already died out. That make us really look bad. But it was, but that timing indeed make a difference. It might also explain why, I think on January 7th, when President Xi Jinping was issuing a directive on the how to handle the outbreak, which the full content remains to be disclosed, but people were speculating, right, that while President Xi said, well, you guys need to really pay close attention to that problem. In the meantime, very likely this is like a typical, right, the central government response is that, well, you don't want to, cause panic. You don't want to spoil, the environment, the atmosphere for celebrating, the Chinese New Year. So that I think, when you're a local government official, when you receive that message, that really there's not much you can do, right? The best response, is actually not to take any action. Right?
That's fascinating. So I wanted to kind of open the aperture a little bit and ask you. You touched upon this already in some of your responses, but I wanted to see if there was a more systematic way of approaching this question, which is, what has China learned and what has China not learned, or at least not put into practice with regards to lessons from the 2003 SARS outbreak?
Well, when we look back, right, I found it is interesting after the end of the SARS outbreak. There's a lot of this publications, discussions talking about how SARS represent a watershed, right? This is not going to happen, again, in the future. Indeed, if you look at the government response, by under the Hu Jintao, Wen Jiabao, the government, they have, undertaken, some serious measures to tackle the problem, to improve transparency, to invest in disease surveillance and response capacity building, to also improve international cooperation. The new laws, regulations being released, to they even also changed the national security law, to no longer making, the disease, related information release a national secret. So that was a time that was very, very encouraging, I think. But over time, I think it turned out that transparency continued to be a problem. And secondly, it has not fundamentally tackled the issue of, as we have discussed, the upward accountability by the state-society relationship. So that we see essentially the same pattern, right? Now after the China managed to contain the spread of the COVID, right? You certainly have seen China, make significant attempts, to fix the loopholes in the public health system, to release, for example, the new biosecurity law, right? But in the meantime, that I haven't seen any serious discussion, how, the political institutional aspects of the problem actually contributed to the crises, and how we should fix that. There's in fact, if you look at the government, the white paper, right, on China's handling of COVID, well, that is essentially the official narrative on the COVID, right? It's all about how China cooperated with the government was, how wise the leadership was, but even that initial mishandling of the outbreak was actually eliminated from that narrative. So that I think does not bode well for China, for the entire world, actually, in a way, to prepare for the next disease outbreak. I remember 17 years ago, one of my article was included in that book published by Institute of Medicine, now part of the National Academy of Science. I said, if this problem were not properly handled, we're going to see the same story, the tragedy being repeated. And unfortunately, that is indeed the case. And hopefully, I certainly do not hope that is going to repeat, that same tragic is going to repeat it again in the future.
Yeah, and in the years leading up to COVID-19, there have been people warning about the likely increased frequency of these types of events as we move into the future. That rather than seeing fewer and fewer of them, we're going to potentially see more and more. So that is something that is sobering, to say the least. I've got two more questions before I move to our audience. The first one has to do with one of the ways in which people have really gotten a kind of a human perspective of how epidemic, at the time was unfolding in China was through social media, blogs, and I guess most famously in what has now been published as a book, Wuhan Diary, by Fang Fang, or by that nom de plume of Fang Fang. What have you seen in social media emanating from China that has been how accurate and really how inaccurate has the general trend of social media reporting from China been in your experience and what you've seen?
You're talking about how accurate the description was?
Yeah, I mean, I just wanted to get a sense of if you were, if somebody didn't know anything about China or about the coronavirus, but, picked up, say Fang Fang's book, Wuhan Diary, what would, or followed things on WeChat or on, or other types of social media platforms, what are they likely to have left out? And really what I'm doing here is I'm leading up to a comparison with the way in which it has been essentially described here in the United States. And that is to say not simply China, but the coronavirus outbreak in the United States.
Well, yeah, for sure. I think everybody, including those who were in Wuhan, when they look at this, the epidemic or the outbreak in the beginning, right? They might have different perspectives. I think, and also keep in mind, I think the perspective can also be changing. I remember it was one of my. A friend of mine was who happened to be living in Wuhan. Initially, right, like in the December, early January, I forgot what the exact time is that. When I was, showing my concerns in the social media, that there might be, something horrible, that could be happening. He would just say, that you guys overworried for us, that, our government will be able to handle all this very well. But they, that in the end of January and then early February, he started to say, oh, our government indeed didn't, do very well in handling that outbreak. But then, if you look at the March, right, he changed his mind again. He said our government has done a fascinating, a very successful job, right, in containing the spread of the outbreak, right. And I think Fang Fang was certainly when he was recording what happened in Wuhan, that she was looking at from her own perspective, and in the meantime, she was recording that special part of the history. Well, that was like the end of January and the February, right? The way, the lockdown being imposed, in a way, the government actually showed there was a lack of effective capacity in handling the outbreak due to the shortage of testing kits, right? The lack of hospital beds. Many people could not even get diagnosed, and some even got diagnosed, could not get admitted into a hospital. So many people, just to die at home, without any proper, medical care. So that was indeed a very, very sad, very tragic stage, right, in the when the crisis was unfolding. So I think it was again, she certainly, I think, provide a very unique perspective on a particular period of the China's handling of the outbreak, but certainly what is not the characteristic of the entire story that in Wuhan.
Great, thank you very much. And it turns out one of the questions anticipated my final question. So in the interest of time, what I'm going to do is I'm going to move to the Q&A so that we have some time to discuss those as well. And I want to start with I'm going to read this verbatim. It is from our colleague and friend, Mike Lampton. He asks, Yanzhong, is it true that early on in the outbreak, meaning in January, it was the Chinese medical professionals who released, unauthorized, the genomic structure of the virus through scientific channels that was so helpful? But the Chinese government then initially clamped down on those releasing the data. Later still, the Chinese government then implied it released the data and was transparent. Your comments on those, and then just as a follow-up, also, how would you describe the initial China-US CDC interaction?
Okay, so thank you, Mike. I think Micah has two questions. The first question is about this release of these genomic data on the genomic data on the virus. That still, I'm still trying to connect the dots, figure out what exactly happened at that time. The story, I think, I'm sure there's, to my knowledge, some reporters actually working on that issue, but the story is actually, it was a very messy story. That there was this Chinese scientist, Cheng Yongzheng, right? He was working on the genomic sample, the sequence of the virus. He was one of the first, to develop, to find, figure out this the genomic sequence of the virus. But at that time he is also still affiliated with China CDC. Even though he has multiple hats, he's also leading a lab in the Shanghai Clinical Public Health Center. There, he has a lab there where he did that work. So I think initially this is my speculation. There were some efforts trying to persuade him or convince him not to release the data. And when he, I think, did that, without, the listening to the advice, that his lab. Well, that might explain why his lab was later closed. In Shanghai, but certainly later, was. There's official narratives that show, how the government was very quick, in coming up with this genomic sequence of the virus and share that with the international scientific community. It's still, we don't know whether this is purely out of driven by this bureaucratic, lack of effective response, or simply out of this is private incentives, that some people want to publish the papers, therefore want to monopolize the information, right? So that is still, I think, a black box in a way, that I don't know whether, and I'm not even sure whether we're going to have, the access to this information to connect all the dots, to present a whole story on what exactly that happened. You might recall that there was like early January, the the Health Commission also issued a circular, basically prohibiting those labs, from conducting doing unauthorized analysis of the virus samples. They should destroy all these existing virus samples. So this is very messy, and we still, but there's no doubt, China has significantly improved its capacity in doing the diagnosis. During the SARS outbreak, it took them months actually to figure out what was the etiological agent of the outbreak, right? Initially, the chief scientist of China CDC identified it as a chlamydia, which is like a bacteria that causes the SARS, because that became a sort of laughing stock there. The second problem, US CDC in China, well, this is also another, actually, there's a lot of story where I think we still don't have enough information, again, to understand why China initially refused the CDC, US CDC personnel to go to China. And certainly, because the US eliminated that the position in China, so they lost their years in monitoring the spread of the virus in the country. But when they proposed to send CDC staff to China, it was China was not enthusiastic in the beginning. That might have something to do with the major, this political, the relationship between the two countries, which is already deteriorating at that time. Certainly.
Thanks very much. I want to move to, and I hope I'm pronouncing his name right, to Stephen Alt, who asks, of the 2 to 3 cities in China which may have experienced COVID-19 cases early on, was there a significant difference in their local public health and public health laboratory and healthcare capacity? As well, if the virus arose from contact with bats or other forest-dwelling animals, how do these 2 to 3 cities differ in their exposure to bats and wild animals, whether it be geographic overlaps, wet markets, etc.?
So which the 2 or 3 cities, which 2 or 3 cities are we talking about?
So he doesn't specify in the, but I would imagine, so places like Wuhan, Yichang, and then there was another one that escapes me right now, but insofar as it's unclear whether it originated in Wuhan, and may have originated in other cities within Hubei and migrated to Wuhan.
Yeah, well, that possibility. Certainly, we cannot rule out. I think we should indeed make a distinction between the origin of the outbreak and the origin of the virus, especially as when we talk about human-to-human transmitted virus. Because if we focus on the origin of the virus, I think it could be an open-ended process, right? Already, right, that these people were suspecting, right, that this might be originating in Italy, right, even India, right? This slope could become very slippery, if we talk about, tracing the origin of the virus itself. But if we talk about the origin of the outbreak, right, the outbreak is defined as sudden onset of an illness, right? And you've certainly here the local capacity, right, to do the correct diagnosis, makes a difference. Maybe it was in Wuhan, that compared to the neighboring cities, which certainly do not have robust, diagnosis laboratory capacities, they might actually misdiagnose or fail to detect the outbreak in time. So it is, possible, right, that the outbreak, is officially, detected in Wuhan, but doesn't necessarily mean it was a origin point of the outbreak. But I think in the meantime, meantime, there seems to be more, I think, this convincing evidence suggesting, that this outbreak occurred in Hubei province, that not elsewhere.
Thank you very much. And I know that we have about 10 more minutes. What I wanted to do is combine two questions which look at the same topic, but come at it from slightly different directions. So they're from Madeline Ross and from Jennifer Lee. So Madeline's question is, Beijing currently looks like a winner compared to the US in COVID public health management. Could you say more about how the public health crisis undercuts Beijing's global ambitions? And do you feel that the reported COVID mortality numbers have been underreported? Jennifer's question comes from the perspective of, well, I'll just read it because she phrases it very nicely. Good morning, Professor Huang. In 2019, a Johns Hopkins Global Health Security Report ranked the United States #1 and China number 51 in pandemic preparedness. Yet we have certainly seen the mishandling of the outbreak in the United States, though the US criticizes China for its respective response. What policies should Beijing consider to strengthen their responses to public health crises in the future? And what lessons should the United States and the rest of the world learn from the Chinese experience? Thank you.
Okay, great. I'm going to answer the second question first, right? Before the outbreak, there was this Global Health Security Index. We ranked the countries in terms of their pandemic preparedness, right, capacities. The U.S. is ranked at #1. China was number 51. Well, certainly but what happened during the outbreaks is actually contradicted to that the predictions. But U.S. turned out to be handling the crises very, very poorly. We were indeed the world's the COVID capital with the most cases and most death. And China, in the meantime, right, even with this initial mishandling of the outbreak, it managed to rein in the virus spread in a very short period of time. Essentially by early April, right, with the lifting of the lockdown in Wuhan, China started quickly those economic and social recovery. So that index, doesn't seem to be a very good predictor of the country's response to the COVID outbreak. But it also shows, that in the meantime, the China's response to the outbreak had its own problems. I remember in 2014 when the government conducted a self-study of its compliance with international health regulations requirements on core surveillance response capacity building. It basically said we met more than 91% of the IHR requirements. If we take into account the initial mishandling of the outbreak, that is certainly there's also room for China to improve itself. In the way I think we are dealing with the outbreak that is very unique, a virus that is highly transmissible, potentially lethal, which is very different from the previous outbreak like the 2009 H1N1 pandemic. And that pandemic, that virus happened to be very sensitive to, I think, a centralized system. If you have, I'm not certainly saying I'm favoring a centralized system, but if you have a centralized system, that which the leaders have the capacity, right, to make decisive actions, to implement that actions, right? I think the solution is relatively simple. It's like a no-brainer. You just have people stay at home, for more than 3 weeks, for 3 weeks, pretty much the virus will die out. Well, this is actually what happened. happened in China, right? So that approach is not like, really that fancy, although they certainly rely on high-tech means, big data, cell phones, right? But you basically use that to monitor people's movements, right? Make sure, right, that they follow the government, requirements, But in the United States, unfortunately, we are a federalist system. That happened to be when the election period, this partisan politics, that actually prevent us from having an effective response to the outbreak. But I think that I remember it was like February or March, I wrote that article in Foreign Affairs talking about how President Xi emerged as a winner, right, from the pandemic. Well, it is true, the pandemic, the outbreak has actually helped beef up the CCP's legitimacy, right? According to the UCSD study, right, the people's trust in the political system and their leadership has significantly increased, from 1 year ago, 1 year before. But in the meantime, I think there's a Chinese old saying, in the dialectical sense, right, that bad things can be good things, good things can become bad things. Now with the rollout of the mass vaccine initiative in the United States and the UK and the Western countries, I think the vaccine could become a game changer in this great power competition. It is likely that the US and the UK is going to achieve herd immunity by the most optimistic accounts is by the end of May. By that not be able to achieve the same herd immunity. So that by that time, I think it will be making it very difficult for China to point to this success and U.S. failure to contain that its political system is more superior. It's superior to liberal democracies.
Fascinating. So I'm gonna. This is the speed round. So I'm gonna ask one more question, and it'll be a complex question, and you'll have about 1 minute to answer before we have to go off air.
Okay.
But so our colleague and friend Carla Freeman has written about areas where the U.S. and China could cooperate, even in this period of a cooling of relations. And one of the obvious area, or not obvious, but one of the kind of the natural areas of cooperation, she wrote, and this was before COVID-19, was in pandemic response. And that seemed to be an unassailable argument. And yet here we are in a very, very different reality. I mean, if there's been one thing that underscores the US and China in the era of COVID-19, it is not cooperation, anything but. And so how did that happen? Why did things turn out differently than we had anticipated?
Great question. Thank you, Carla. That was sort of surprising, given that the US and China were able to cooperate with each other during the 2009 H1N1 pandemic and during the 2014 Ebola crisis, and also even before that, the Chinese fight against HIV, right? So why that didn't happen, right, in the COVID, the pandemic? I think there are two unique developments, I think, in the pandemic. One is politicization of the outbreak. The second is a securitization of the pandemic. By politicization, I'm talking about how even those issues like, the origins of the outbreak, right, China's relationship with the WHO have become a political issue. And that is certainly intertwined with the US domestic politics, electoral politics, to make it, like, for example, President Trump, right, point to China as a scapegoat for its own mishandling of the outbreak, right? So this politicalization makes it very difficult for the two countries to build trust, right, to cooperate with each other. The second problem is securitization. That is, when we frame the pandemic as an existential threat, and rely on those emergency measures, to handle the outbreak through like travel bans, through and use this warlike, rhetoric and languages to describe, the pandemic and how to respond to the pandemic. We created the atmosphere that exacerbated the security dilemma, that increased the mistrust between the two nations. Because when we say this is a national security problem, in the anarchic situation, each country would also only care about their own national security, right? So that relieves the moral obligation, basically for countries to reach out to other countries, to help other countries, so that leads to a more individualized, fragmented, and state-centric response to the outbreak.
Thank you very much. So I want to thank everybody for attending. We're going to have to leave it there. I could spend the rest of the day just having this conversation. Professor Huang, wonderful to see you. Wonderful, and thank you so much for giving us the opportunity to really kind of peer into this key phenomenon of 2020, and hopefully not too far beyond. Very much looking forward to following your work on all of this, and look forward to seeing you at an HNC or a larger SAIS event very, very soon. Until then, I want to thank you and ask everybody to please thank our presenter today, Professor Huang, Yanzhong.
Well, thank you, Andy. Delighted to be here, and also thank you all for participating in today's event. And thank you, Andy, and also Dean Cohen for inviting me to this wonderful event. Thank you.
Take care. Bye-bye.
Bye-bye.